Happy Monday, everyone. Welcome back to Parent Power Hour. Hope everyone is doing well. Thank you so much for joining us today. We are once again having our illustrious pediatric experts, we'll say, Dr. Baudry and Dr. Elliot, rejoin us again. They offer really some key insights when we had them on last, speaking about some of the implications of COVID-19 on our young people, as well as vaccinations. And tonight, that is actually the topic again of our show, students and vaccine, kids and vaccines. So we'll be looking forward to hearing what these two fine doctors have to say about that. Not joined at the moment, is Tyrone. We're not joined, I'm sorry, at the moment by Tyrone, faces the franchise, but hopefully he'll be along at any point. But still, we invite you to join, ask questions, make comments as you always do. Such a great and participatory audience that we have. But before we go any further, our opening question, our connection question, our circle question is, when you're at a movie, well, I'll take that back. Rather, you're in a theater or at home, you're watching some kind of movie. What is your favorite snack? If you have two options, either popcorn or candy. Popcorn or candy. That's it. Those are the only two options. If you have to choose, audience, Dr. Baudry, Dr. Elliot, let's hear what you have to say. Dr. Baudry, you can go first.
So for me, whenever I watch a movie, it's got to be popcorn. So yummy, and that salty popcorn, and then you need a drink, of course, to to balance it out because your lips are all numb. But yeah, I love popcorn. It's delicious.
All right, thank you, Dr. Baudry, for sharing that. Dr. Elliot.
I have to agree. I would definitely say popcorn. I know I will eat the candy too fast. And so the popcorn allows me to taste myself. So I always use popcorn.
And we are 3 for 3 because popcorn it is for me. Absolutely the savory flavor and the pacing, perfect combination when you're watching a film or some kind of entertainment. Thank you all so much for participating. Family, we're looking forward to your answers. Popcorn or candy when you're watching a movie. You can only choose one, popcorn or candy. Thank you so much again for participating. But we have some serious questions and serious matters to talk about tonight. There's a lot as we're going through now in this stage of the pandemic. And of course, variants and other things are on the horizon, even as we talk this evening. But we wanted to talk about vaccines for our young people. But first, let's talk about, actually, I remember very, very plainly, Dr. Baudry, our first question about cafeteria being super spreader events. I remember that was one of the things that you were really concerned about back when we interviewed you all both last time. So I'm wondering, have they been big sources of COVID spreading? Why or why not?
Yeah, so that's a great question, and you're right that definitely has been one of my concerns, since children need to take off their masks in order to be able to eat, and we know that masking is helpful in order to prevent COVID spread. So honestly, we don't really have great data yet, and it's really hard to tease out spread happening in the cafeteria versus other places. And so in terms of studies that I've seen, I really haven't seen many studies. That said, we do know from studies that have been done that masking in schools has been shown to reduce the amount of COVID spread. And so, they've done a couple of studies now that came out in the fall showing that with universal masking in schools, that the number of outbreaks was significantly less in districts where they required masking. So they compared, for example, a district that required early masking versus those that didn't require any masking at all. And what they showed was that the outbreaks that they saw in counties in Arizona that were, different districts, it was actually a third in terms of the number of outbreaks in those schools that were requiring masking compared to those that weren't. So I think we have good data that masking does prevent spread. In terms of within the cafeteria, we know that that's still the case, but I think some of the things that have made me feel a little bit better is that, considering that is that, the time that they have their mask off is a pretty short amount of time compared to the full day. And so while it's definitely still a concern of mine, I think that, from what we've seen so far in our schools, fortunately, we've seen some outbreaks, but not the same number of outbreaks that other districts have seen. And certainly I know that some schools were able to do outdoor dining or outdoor, lunches in the fall, and now they're having to move inside. And so our school actually has done indoor eating this whole time. And fortunately, they've had assigned seating, to sort of minimize the number of children that they're exposed to. So, I think the fact that our at least within Baltimore City, they're testing every week in terms of asymptomatics, that, at least our school has assigned seating and are trying to, spread everybody out as much as possible. And the fact that there, really is a pretty short amount of time. And for our kids, we just tell them, put on your mask as soon as you're done eating. And hopefully those things will reduce that risk. The other great thing is that many of our school-age children are now eligible to, all of our school-age children, except for our pre-Kers potentially, are all eligible by age to be vaccinated. And so it provides another layer of protection in addition to the ones that they had starting out the school year.
Thank you, Dr. Baudry. If I could follow up, in those studies that you're looking at, are you able to glean where the outbreaks are occurring at higher rates, if not in the cafeteria? Is there a way we can glean that out? Is it in the classroom? Is it in the hallway?
Yeah, so I mean, those are really hard things to sort of tease out, and really that depends on really good what we call contact tracing, where you look at each individual case where somebody has come down with COVID and you trace back to see exactly where they probably got that case. And unfortunately, we don't really have that level of data right now for many of these studies, and I'm hoping that will be coming out. But currently, the studies that I've seen don't have that degree of sort of granularity to their data. But certainly, you're at risk anytime that you're within contact with other people, but it's all about those layers of trying to reduce that risk. And so, keeping the distance as much as possible, wearing your mask as much as possible, vaccination as much as possible, all of those things together are used to sort of reduce that risk.
Thank you, Dr. Baudry. Pivoting to Dr. Elliot here, and it just kind of, Dr. Baudry led into the question and conversation about vaccines now for our school-age children. Can you kind of walk us through the difference between vaccines for adults versus vaccines for children? Of course, a lot of parents are still wondering about just how safe those vaccines are.
Yeah, definitely. So overall, if we think about COVID vaccines, we kind of talked about this the last time we were on, but just to review, those are used. There's a 2-shot series for both children and adults, and both of them are used to decrease the spread of infection, decrease symptoms, and hospitalizations and death. So just as the frank kind of frame of that, in terms of the I guess quote unquote children vaccines, it's not that much difference between those besides dosage. What has been kind of studied, I shouldn't say kind of, it has been studied a lot, is the response to the immune system after receiving those doses. And so a lot of this testing has really gone on to try to figure out how much do we actually need to give a child in order for them to mobilize an immune response. And so that has shown that those reduced doses that children are getting are showing the same, if not better, immune responses as those who get the full dose in their adulthood. And so that's the overall data in terms of safety and efficacy. In the same way that this has been studied a lot in adults, this has also been studied a lot in children. Actually, a couple of my fellow colleagues actually had their children in the vaccine sites, which has been cool. But either way, that has been studied for a very, very long time and very rigorously to try to figure out if there are side effects. And whatever, what have you. Now, what we do know is that the side effects are very minimal. It seems to be around the same side effects as an adult in terms of may find a little bit of injection site soreness, maybe a little fatigued after their shot, mild headaches and things of that nature, but nothing really serious to report. I know that there was some question, and I know we talked about this, and Dr. Baudry probably will talk about this a little bit more. But in terms of like risk benefit, and I know we kind of talked about that a lot at our last meeting. I still would say that the risk benefit is heavily towards getting vaccination. If I were to choose vaccination and the mild side effects versus choosing to put myself at risk of COVID or getting COVID, I would definitely choose the vaccination. And I think there's always been, a little bit of conversation of, we don't really know what this is going to do and, long term. What we do know, as we talked about last time too, is long COVID is a thing, not only for adults, but also for children, as well as, and I'm sure Dr. Baudry is going to talk about this as well as MIS-C, inflammatory conditions due to COVID. So when I think about that, I would heavily endorse vaccination.
All right, thank you, Dr. Elliot, for that. And again, another segue, Dr. Baudry, Dr. Elliot, kind of talking about vaccination pros and cons. And one of the questions that are, kind of permeates not just our district and people in Maryland and Baltimore, but you hear this question throughout the country, and that is, if you're having breakthrough cases of the virus, what is the point of getting the vaccination? Some people think, well, it's not working if I can still get sick and still have symptoms and on and on. Can you kind of help us understand what exactly is happening? And I would say part of it is some miscommunication from the outset, maybe from the medical community, and so can you give us some
Absolutely. Yeah, so the vaccine, as Dr. Elliot was saying, is safe and effective. And what we know is that, from the studies that we've done, and, going back all the way a year ago when we were hearing about the vaccine for the first time, and we heard, 90+% protection. I mean, that's kind of amazing to hear, you have 90+% protection against COVID. And what we know is that, the vaccine remains really good at protecting against COVID. There is some, and we'll get into this in a second, I think, about boostering. So there is some, over time, your protection slightly goes down, but overall, even with that slight going down, you are protected at least 60 to 70% against COVID, and even more against hospitalizations and against death. So I think that's a big message to say, is even with the vaccine having breakthrough cases, you're still protected quite significantly against both getting infected and having symptoms as a result, and even more so against hospitalizations and deaths. And so it's a little bit like a seatbelt. You think about wearing your seatbelt. Wearing a seatbelt doesn't prevent you 100% from getting in a car crash and getting hurt, but it definitely helps you and prevents potentially, serious injury. And, I think we've all seen cases of, car accidents where you think, oh my goodness, like that was a really serious car accident, and the person walks away or has minor injuries because they were wearing their seatbelt. It's kind of a similar scenario where getting a vaccine doesn't 100% protect you, but it does a really good job at hopefully preventing you from getting the most severe complications and also dying from COVID, and also provides as a sort of benefit also that you are protected against symptomatic COVID as well. Because nobody wants to be, even if you are protected against hospitalization, nobody wants to be laid up in bed for a couple of weeks and not being able to smell and not being able to taste, and having to miss work and school and all of those sort of things that come along with that. So it actually does a really good job. There are breakthrough infections, but by and large, the people who are being hospitalized are still typically those who are unvaccinated, especially younger people. And we know that for that older age group, sometimes the vaccine doesn't quite work as well, or for our immunocompromised, people who are, receiving cancer treatment, they may not respond as well to the vaccine, but the vast majority of people will actually be quite protected against hospitalization and death from the vaccine.
Thank you, Dr. Rogers. That's a really good analogy there, the car crash, and something that I think people can relate to. Just a follow-up about mutations. Maybe our question is, won't the virus still mutate? So we've seen that does happen, that has happened. Can you maybe this is a selfish question. Can you walk me through how a virus mutates, why a virus mutates?
Yes, so definitely. So, every time a virus or any cell makes a copy of itself, it can make mistakes as it makes that copy. It's kind of like if you're writing down, you're copying the same thing and you're only able to see the line right above what you've copied. As you make those copies, there are going to be little errors that kind of, creep in, right? And there are different mechanisms that our bodies have to sort of figure out the errors. But for viruses, in their case, they actually want some level of these mistakes to happen, because sometimes when they have a mistake happen in their copy, it helps the virus to replicate faster, or to be able to spread from person to person faster, or it can make it last longer in the body. So all sorts of things that can help it to survive for longer. And really that's the advantage that the virus is looking for. And so sometimes when that chance happens, when there's a mutation that helps the virus to do one of those things, it can be easier for it to survive and to go from person to person. And it gives it kind of like a survival benefit. So a little boost. And as a result, that's why we have all these variants, because every time just by chance that mutation happens where it gives the virus a benefit in survival, it makes it more likely that that's going to be, that's going to become our predominant sort of variant. So the way to sort of prevent that as much as possible is to prevent the number of times that it's replicating. So if you're able to sort of decrease the number of times that it's going from person to person, and then, sort of as a result, potentially having those chances to mutate, you reduce the chance that the variants are going to spread. So, I think that that's one of the reasons that we've talked about, how having vaccinations throughout the world, not just in the US, but really throughout the world, because as we've seen, mutations can pop up in any location of the world. And when that happens, because we live in a very global world right now, where there's travel and movement of people from place to place, that can spread very quickly. And so that's why many people have been talking about the importance of vaccination, not just within the US, but really globally, and thinking about trying to make sure as much as possible that we as a world are trying to protect ourselves against the spread of variants, the rise and spread of variants.
Thank you so much, Doctor. Dr. Elliot, what about this notion of the booster shot? That was something that kind of maybe sprung out last year as an added layer of protection with vaccinations. You hear, different organizations, WHO, for example, saying, well, it might be premature, but how do we reconcile that? Can you talk about the numbers, if you would, and the recommendation of the booster shot? And certainly I would imagine, and you all can correct me if I'm wrong, it's premature for young children to have a booster, I believe. I think it's too early for that, but I'm not sure.
Yeah, so overall boosters would be for those who have already gotten their both of their shots, so their initial series, and it has been 6 months since their initial shot. So the reason why we're kind of talking about boosters right now is because I think this has been kind of inflated by the new variants. People have been a little bit more concerned. Overall, the boosters for what we expect and are seeing in the fact that months after you've had your first shot, the immunity, and this is not, so there's different kinds of immunity, but from what I understand, please correct me, Dr. Baudry, if I get this wrong. But from what I understand, it seems like the immunity can sometimes wane a little bit from that 90% to a lower amount, maybe like 70. And so to try to get that back up to that 90%, there was a recommendation to get boosters. I think that that's overall incredibly important as we start talking about new variants and things of that nature, because as Dr. Baudry said, the more times we give the virus a chance to replicate, the more it's going to have chances to make new variants. So that's the conversation, that's how that's been spurred about. So in terms of, I don't know if I actually answered your last question, but in terms of the 5 to 11-year-olds, no, they would not be eligible for a booster right now because they're just now getting their first 2 shots. Okay, and I don't think that conversation in terms of boosters, at least from what I saw when I looked at the data that's out there, I don't even think that we are even in that conversation yet with boosters for 5 to 11-year-olds. But Dr. Baudry will definitely correct me if I have that wrong.
Yeah. So everything that Dr. Elliot said was correct. And so everyone who's 18 or older, if you got the J&J shot, because it's just a 1 shot, it was just a 1 shot. So 2 months after that, everybody who had gotten a J&J should get another booster, and you can really mix them. And actually there may be benefit kind of looking at the data. If you got a J&J, it could be helpful to get an mRNA vaccine. So either the Pfizer or the Moderna, in terms of looking at how much it boosts your antibody. So it's kind of that mixing and matching. And so it's kind of giving your immune system different ways of seeing, the pieces of the virus, the parts of the virus, so that it's able to sort of recognize, so it's all prepared so that when your body sees the actual virus, it's able to fight it. So for anybody who got the J&J, it's 2 months afterwards. And then for anybody who's 18 or older who got the Pfizer or the Moderna, the recommendation is to get a booster if it's been 6 months or more since your primary series. And we don't really have data yet on sort of the adolescent age group, and most of them got vaccinated in the spring. And also most of them had a pretty robust response. When we look at the data, it looks like their immune systems, they got the same dose as the adults, and their immune systems are a little bit different than adults. And so they had really, really robust sort of reactions. And so it may be that they can, go a little bit longer before they really need a booster, but they're looking at that right now. And then in terms of the younger kids, they're just getting vaccinated for the first time. And so most of the kids are just getting eligible for that 5 to 11-year-old age group. I think, those kids who got it kind of right at the beginning are just becoming eligible for their second dose. And so we won't really have information yet about, when the right timing is, if they need another dose, when that would be. I kind of suspect that they probably will need a 3rd dose, but we'll just have to look at the data. And I think that's an important thing to sort of just say, is that these recommendations are, they do studies in order to test these things. And so they're looking to see, based on these studies, when is the right time, and testing that. So, I think that we'll have to kind of see what the data shows. But for right now, what we see is that people lose their immunity or start to, it starts to wane a little bit or go down. And that doesn't mean that, as we said, that you're not protected at all. You're not starting from ground zero, but in order to sort of boost you back up to that 90%, it looks like that, that 3rd dose really helps you to do that. That's especially true for the older age group because their immune systems aren't quite as robust. So, your senior citizen, sort of your grandmothers and that kind of age group, they typically need a 3rd dose, especially for them, to protect them against hospitalization and death. But for the younger age groups, we've seen that too, that it's actually really beneficial to have that 3rd dose. I think especially, heading into the holidays, and we're already in the holidays, but, heading into sort of that Christmas, New Year season where many people are traveling to see family during the break in late December. And also, just given the rising cases, I would really encourage anybody who hasn't yet gotten their booster and who's eligible to get it.
And Dr. Baudry, one more question about the booster.
Yeah.
Is the booster an additional shot that has the same efficacy as the original series, or is it a stronger dosage?
Yeah, so that's a great question. So for the Pfizer and for the J&J, it's the same dose as the first one. For the Moderna, it's a reduced dose that they've shown still gives you a nice immune response. So it sort of revs up and prepares your immune system so that when it sees the COVID virus, it's able to fight it. So they're a little bit different. In terms of the side effects, they've actually showed that you're less likely to have side effects than with the second shot. Because that's typically, most people didn't have a ton of reaction after the first. And then with that second dose, that's where typically people have a lot of the side effects like arm pain and fever and, myalgias like muscle aches. And with the third dose, the booster, those side effects are still there, but it's less than with that second dose. And same with myocarditis, which is the inflammation of the heart, which I think we talked about last time as well. So that was a side effect, especially in younger people, that people have been especially worried about because it's one of the more serious side effects that we've seen with the vaccine. They, in terms of what we've seen so far, it looks like that risk is less than with the second dose so far. But I think one of the great things about this is that there's also a system where anybody can report any sort of side effects that they think might be related to the vaccine. And that's how the CDC, the Centers for Disease Control, they look at those reports to look for a signal to see if there's anything rare side effects that they didn't pick up in the studies, like myocarditis, which is only seen in one in every several 100,000 people who get the vaccine. And so you're not going to pick that up in a study that only studies, several thousand people, but when everybody's getting vaccinated, you can start to pick up on those rarer side effects. And so they're continuing to look at that as well. And I think that's an important thing to say also about, the 5 to 11-year-old vaccine. They didn't see any cases in the study of myocarditis within that age group, but they only, because you can only do a study so big, they studied 3,000 children, which is actually a lot of children. But you wouldn't expect to see that side effect within that, within that size. And so they're continuing to sort of look for data. The latest I saw was there, I think, 2 million children in the states within that age group who have been vaccinated. And so I think, in the coming weeks, as they get their second doses, we'll be, very closely watching to see if there are case reports of myocarditis. The good thing is that vaccine associated myocarditis or inflammation of the heart tends to be pretty mild compared to other versions of that. And so I've taken care of several children who have needed to come into the hospital because we're concerned about their lab values and we want to just closely monitor them, but they typically are able to go home within a day or two and typically don't have lasting side effects from it. Whereas with COVID, you can also get myocarditis, and those children tend to be sicker and tend to require more hospital care than the ones who come in with vaccine-associated myocarditis.
Thank you, Dr. Baudry. You want to pivot here to one of our audience members who writes in. This is Sheldon Allen. Hello, Sheldon. Thank you for participating this evening. I think we're very lucky to be in a country where kids can access COVID vaccines and adults can get boosters when most of the world can't even get their first shot. Thank you for that perspective. Sheldon Allen, thank you so much. Dr. Elliot, if we've been talking about the holidays and what's coming up next, can you give us some admonitions? I mean, how are we supposed to, especially with kids and folks thinking, I'm vaccinated, I have a booster now, the kids are like, hey mom, hey dad, I'm vaccinated, can I do some things a little bit differently now? What would you say? How do we look at the holidays from a behavior and safety perspective?
Yeah, so that's a great question. And I think, a lot of the conversations I've been having with parents have been like, oh my gosh, and they'll say to me, like, doctors are so risk adverse, like, oh my gosh, like, you're telling me I shouldn't do this and I shouldn't do that, and I want to say before I start this conversation is that, we see a lot of kids and overall want the best and do not want to like kind of see you in another place where, you're calling me and you're like, oh my gosh, you told me that I could go have a gathering of 250 people in Martins West, and I did it, and now we all have COVID. Like, I just don't want to like back up to that. What I would say in terms of the what I would recommend for everyone to do is your masks are still, I would say, very essential at this time. I think there's a lot of conversations about like, well, I'm boosted. All of my children are vaccinated because they're all in the age range and have gotten their shots, you know. And so like, do I have something to wear this mask? I would say yes. And I think the important part is that not only are you mitigating the risk to yourself, but also to others. And so, you know, if the thing that I think about for myself is that like I have more elderly family members. And so I'll be going home. Obviously, me going home means I have to fly. I'm in California, I have to fly back to Baltimore. And so to me, I'm always thinking about, well, you know, like in terms of risk, I'm not going to stay with them. I'm going to use some masks when I get there and things like that, because I'm very risk averse in that way. I do not want to get my elderly parents and aunts and uncles who may or may not have a really great response to the vaccine and could also be affected more adversely with COVID to be at risk because of me. So that's what the first thing that I would say is that please keep using your masks. And I would still, you know, say for the children, you know, they've gotten kind of used to masks in schools and everything like that. And I knew it was gonna be a learning process. It's what I always tell the parents that I see, you know, they're like, well, they didn't like to do it at first, but I think that using masks is still going to be very effective and essential as we move into the holidays, because it's going to be a lot of exposure, you know, whether you, no matter kind of how you go about this, you know, like if you're traveling like me, you know, that's going to be exposure. If you're around a bunch of people, that's going to be exposure. So to try to mitigate that spread and that exposure, I would definitely say use masks. I would also say, in terms of travel and things of that nature, I would say be as safe as possible. We do have, you know, some, and we haven't talked about like the new variant, like Omicron and things, but we do have some sightings of that in the US. And so even more so, I would say for travel, please, 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 because we live in a global world, use your mask as much as possible and try to maintain your distance away from other people. While everybody else is vaccinated, I mean, you can always, you know, take some, you know, I would say I'm risk averse, so I'm going to wear a mask all the time. And I would encourage you to, but I think that, you know, encouraging that conversation between you, your family members, your elderly family members, even with children, as we talked about last time, in terms of having conversations about vaccine, having conversation about COVID. It's been a hard years. And I think that, you know, trying to kind of have that conversation either over dinner or whatever, what have you, is going to be really, really essential for moving forward. So those would be my recommendations right now. I would also say, you know, get your vaccines if you can, and I think have honest and fruitful conversations. A lot of I think that you brought up a great point earlier, and the fact that like there's a lot of information out there, and like trying to get to the bottom of it can be very difficult. And so what I would say is that, you know, have conversations with you and your family members, and also involve your pediatricians, your doctors, and things like that, and trying to have honest conversations about that. Because they're, as we call it, like the vaccine hesitant. I don't really like that terminology, because I think that it doesn't also take into account that we have a kind of responsibility to get that information to those people. And have them voice their questions and things like that. I would say that those who are still questioning their vaccines and vaccine statuses and boosters and things like that have the right to know that information and the right to have that conversation. So that'd be my overall recommendations. I don't know if Dr. Baudry has more.
Thank you,
Yeah,
Dr.
I mean,
Elliot. Okay, yes, Dr.
oh,
Baudry.
sorry.
That's okay.
So I think, you know, like Dr. Elliot said, it's all about layers of protection. So, you know, I think that unlike last year, we have vaccines this year. So that's a really great, you know, extra layer of protection. And for, you know, when everybody is vaccinated, I would encourage everybody to get boosted as well. And if you have school-age children, to get them vaccinated as a layer of protection. And then I think it's really about a sort of assessing what the risk level is within the group. So if you have elderly family members, as Dr. Elliot was saying, then, you know, thinking about, can you see them, you know, outside, or could you see them inside with masks for a short period of time, or, you know, For smaller family gatherings with everybody who is low risk and vaccinated, especially if you're able to test beforehand, that can add another layer of protection, can be a great way to sort of still be able to gather with your family and celebrate, or loved ones, and celebrate with them. Because I think that all of us have really missed that a lot during this period of time. I know that for Thanksgiving, we were really happy to be able to see my parents and my sister and my brother-in-law, who we haven't been able to sort of gather with for a period of time. So it was really wonderful to see them, but we all tested ahead of time. And really with the rapid tests, they aren't the most sensitive, so they're not the best at picking up. But especially if you do it multiple times in a row, you increase your chance of being able to pick up if you're positive. And especially if you're, thinking about in terms of, am I transmissible? So it may not be the best at picking up infections where you have a low level of infection and you're not really infectious. That would be potentially picked up by like a PCR test when they, do that deep swab in your nose. But it's pretty good at picking up, especially if you test multiple times in a row. If you have, a lot of virus within, and you could be transmissible, the virus could be transmissible to others. So I think using that as an additional layer, and using the precautions that Dr. Elliot was talking about when you're traveling, and just being mindful of, just doing it as safely as possible, knowing that that there are going to be some exposures there. So yeah, and I think that we've seen after Thanksgiving, there has been an increase in the cases. And I think part of that is just gathering together for Thanksgiving. And it's so really, this virus is going to be here for a long period of time. And I think we're all sort of recognizing that we're going to have to sort of figure out and balance these things of, being able to see the people that we love and really be able to live our lives with some sense of normalcy while being as safe as possible. And so sort of balancing those things, using our different ways to try to keep ourselves and our loved ones as safe as possible while being able to still gather.
Thank you, Dr. Baudry. This is from Sheldon again. Comment and then question at the end, actually 2 questions, and I can split them between the 2 of you. I really appreciated our school arranging a vaccine clinic for our school community and neighbors last week. I'm sorry, Sheldon. Does anyone know what the way forward is for increasing access for students and families in the city? Dr. Elliot, I know you're in California, but you are a Baltimorean, native Baltimorean, I believe. What do you say to Sheldon about that? What's the way forward for increasing access to students and families for vaccines?
So I was going to talk about that a little later too, but I guess one thing I will say is that this is the first time that I have tried to get a vaccine outside of I'm still a healthcare worker, but outside of like a big hospital system. And that has been much more difficult than I thought it was going to be, is what I will say. So my recommendation to everybody, if you are trying to get your child vaccinated, if it's anything like California right now, if you're trying to get your child vaccinated, trying to get your booster, trying to get someone else vaccinated for the first time, is to, spread the wealth, talk to multiple pharmacies, see who has spots and openings, is what I would say from the first hand. So in terms of getting children vaccinated, so there have been drives, and I'm glad they're also doing that in Baltimore as well, but at least in California, there has been drives to kind of bring the vaccine to children. And so that means, not just going to your pediatrician's office, but also bring it to children in terms of in terms of schools. So I think that's a really, really good way in terms of like health services research, trying to understand how do we do this the best way to affect the most amount of people. I think that's a great way. I think it has to come to the children. I think that there's going to be ramping up since we've had the 5 to 11 vaccine, it has been a ramping up of capacity for pediatric offices to kind of give that. And so what I have seen is that pediatric offices have kind of started to make, I don't want to say like vaccine days, but certain hours in which they have been, tailoring their response just to giving vaccines and making sure that we get kids to the clinic. So that's another way. I would say also locally, there are, and like I said, I would call multiple places. But if it's anything like California, Rite Aid, Walgreens, and things like that do have 5 to 11 vaccine days, I would just say to make sure that sometimes those days are different than the adult ones. So if you're thinking that you're going to go, and get a vaccine for both you, and you're going to get your booster, and you're also going to get your 7-year-old vaccinated, it may not happen in the same day, unfortunately, just because of how the mechanism is working right now. And I think that's just because there's been a higher demand, given the fact that, I think people are more concerned about the variant. But I think the future, honestly, if I were to make a healthcare system, is that we would bring all of the vaccines to kind of the children. There's always the question of like, can you store the vaccine? Is there a place to store it and things like that? That's always the question with these types of things. But that's what I would say. And I think there's also some room for after school programs and things like that. That's also at the school. And also, there's also a vaccine clinic here. I live like up the street from one of the Ys. And so the Y of LA is also trying to, because that's where youth are as well, are also trying to give a vaccine there too.
Thank you so much, Dr. Elliot. Dr. Baudry, you mentioned testing prior to getting together with family. Sheldon asked, what are your opinions about the home tests? Are they more accurate these days?
Yeah, so like I was saying, they're not as accurate as your PCR test, but the benefit that you have with the rapid test is that they're rapid. So the result comes back right away. And as we all sort of know, I think it can take a couple of days depending on how busy, they are in terms of turning around your PCR test. And so, if you test on, Monday and you don't have your result back yet on Wednesday or Thursday when you're about to see your family, that can be really hard, right? And you also could have been, you could be positive now, right? Because there's a lag of a couple of days. So the benefit of the rapid test is that you're testing yourself right when you're going to see your family or whoever you're going to see. The thing to sort of do in order to increase how good it is at detecting if you're positive is to do that multiple tests. And so many of the tests that you can get over the counter now have that instruction. And, I think it can be easy to sort of miss it if you don't read it carefully. But what you want to do is to test once and then a couple, I would say 24 to 48 hours before you're going to see your family, and then test again right before you see whoever you're going to see. And in doing 2 tests, if either is positive, then you're positive. And so in doing multiple tests, you're increasing your chance of being able to pick up if you're positive. And the tests are especially designed to pick up positives when you're infectious. So, it may not pick up some of the cases where you're not as infectious yet. But the hope is that you're picking up the cases where you are really infectious and you could be a risk to other people. So that's sort of what I would say about rapid testing. And I do think it's a really nice thing to be able to do when getting together with people that you care about. They obviously do cost money. And so I think that's a barrier. And I know that right now, at least for private insurances, Biden has been making, is trying to get that covered by private, health insurances. I would love to see that occur for everybody and for it to be much more widely available, because I know that getting your hands on one of these tests can be very challenging, especially before the holidays. So if you're able to, it might be a good idea to stock up before we sort of head into winter break when people are all sort of trying to get the test at the same time. The other thing I just wanted to mention is that for people in Baltimore, there's actually a really nice list of vaccination clinics within the city, and there's different locations every day, and many of them are just walk-up clinics, which is great. So you don't need to register ahead of time. You have time. You're like, today is the day. You can go get it done. So if you look at the website, and I can share this link, there's different locations every day in order to get access to it. But I totally agree with Dr. Elliot that making sure that, these are accessible and sort of available at the places that people, go, and making sure that it's, in all sorts of different locations so that everybody has access to these is really important.
Thank you, Dr. Baudry. Dr. Thomas Courtney James writes in. Courtney says the YMCA would be a great location, Dr. Elliot. I need to look into that. So that is affirmation from Courtney. I don't know what part of the country Courtney is watching from, but kind of to your point, there are young people there, all people, a lot of people of all ages frequent the YMCA throughout the country, throughout the world even. Thank you, Dr. Baudry, for this link vaccine clinics. And I would agree that I won't say they're easy, but they do seem to be plentiful. Working in schools, I'm certainly hearing where schools are having them, where they're having also mobile vaccine clinics. So they do seem to be plentiful throughout the city. I say that with caution because I know that everyone doesn't have access, even though I'm seeing a lot throughout the city. So I do say that with caution, but thank you for that link. Dr. Elliot, you were mentioning the variant. Here's your opportunity. We don't know enough about the new variant. This is just almost breaking news just a few days ago. But is the vaccine likely to be effective? And this is a I think a key question for a lot of folks because they hear the vaccine and for I would say lay folk outside the medical community, it seems like okay, the vaccine is for this particular strain. And so then when there's a variant or a mutation, then it would seem that you'd have to have a different vaccination for a different strain or mutation. Can you help us with that? Is this current vaccine going to be effective? Will it make a difference?
Yeah, I think that's the question on everybody's mind right now. I think that we have very, very, very preliminary data because we kind of just identified Omicron. And so the very preliminary data, it seems as though the vaccine should be effective, but we don't have enough numbers of people to say that for definite. So I think that we'll have to kind of watch out for that. I think that, as we talk about vaccine and, strains, I think that, in comparing this to something that we always say as pediatricians, like, oh yeah, you get a different flu shot each year because the flu shot changes. I mean, the flu changes. And so what needs to be kind of understood, I guess, and kind of explained is that there are different ways for a virus to mutate, right? So if it were to mutate to the point that, oh, this is more infectious, right? Could be a number of reasons why it is more infectious, right? It doesn't have to just mean that, it's more infectious because the vaccine does not work on it anymore. So that is a question that I think we're trying to answer right now. There's other ways that vaccines can become more infectious in terms of how far it can spread from the mouth to the nose or whatever, what have you. And that could not be affected at all by the vaccines. It could be more infectious, yes, because you sneeze and it travels 10 feet instead of 6 feet or something like that. However, the vaccine still works just as well because the immune system is kind of attuned to seeing a piece of that virus and saying, oh, this is not supposed to be here. Cut it out. Let's get it, and so I don't think we exactly know for Omicron exactly how that works yet in terms of whether it's evading our vaccine or whether it is becoming more spreadable, I guess is what I would say, to not use too much technical knowledge there. But if it's more spreadable, I think that we should be concerned overall about trying to get vaccine. I think that Omicron does present a challenge in terms of knowledge, but what we saw from Delta at least, right, is that even though we did see that Delta did become a little bit more transmissible and things like that, the vaccine overall is still keeping people from deadly infection, very symptomatic infection, and things of the like. And so I would love to put my money on the fact that that is also true for Omicron.
Okay, yeah, and it's a great point you make with this being the initial stages of even knowing that there is a variant called Omicron because I think the first case in the country, the traveler that went from South Africa to your state, your current state, Dr. Elliot, was vaccinated, fully vaccinated. We heard also that happened in New York. So I think it is a little premature for that information. Dr. Baudry, you were going to say something and I had a question, but I forgot. So you go
Yeah.
ahead and maybe I'll
Okay.
remember my question.
Yeah, I mean, I totally agree. We don't know yet. And I think kind of like we're saying, we need data in order to be able to say things. And I think that's an important part of science, that we can't go ahead of what we actually know, right? So we can kind of guess, but we don't actually know. I think there are some reasons to think that, while we may not have quite as much protection based from vaccination, that there still will be some protection. And I think it's important to say, it's not an on or off, like you're protected and now you're not protected. It's usually kind of like we've seen kind of a slide in the amount of protection. So if you're boosted and you're at 90%, it may kind of slide down a little bit. And now we're back in the 80%, 70% range, but we won't go to you have no protection at all. And so I think it's important to say there's still almost certainly going to be some benefit. The question is how much benefit there is. The second thing is that when we vaccinate people, basically your body develops antibodies, and that's the thing that sort of recognizes when you see the COVID virus, it's able to bind to the part of the COVID virus that you're vaccinated against. So the spike protein is something that most people may have heard about, because that's the part in the vaccine that our body sort of gets trained against. And so when you're vaccinated, you form antibodies to different parts of the spike protein. So it's like you have this protein and the antibodies are recognizing different parts of it. And while the virus may mutate, a portion of that spike protein, it doesn't entirely change altogether. And so probably the antibodies that you have as a result of vaccination are going to recognize part of that spike protein. The question is how much, is it going to be reduced because of the variant? And that we don't know yet. But I'm hopeful that there will still be, a decent amount of protection, even with this new variant.
Thank you so much. Sheldon took advantage and took a look at the link. Thank you, Sheldon. Sheldon makes a comment. I learned that this schedule is only updated for the week late on Monday afternoons. So you should call if you're looking for a clinic on a Monday morning. Thank you so much, Sheldon. So Dr. Baudry provided us with the link. Those of you who may have been joining us or haven't had a chance to look at that link, thank you so much, Sheldon, for checking that out right away and passing that knowledge on. Sheldon says call if you're looking for a clinic on Monday, as the schedule is updated for the week late Monday afternoons. I do remember my question, Dr. Baudry, and Dr. Elliot mentioned it. We're not hearing as much about the Delta variant. Is that because of success rate, or what would you attribute that to? How did the vaccines deal with Delta thus far?
Yeah, so I think the reason we're probably not hearing about it as much, it's actually the predominant variant that's still, being transmitted throughout the US. But I think at the beginning, there was a lot of uncertainty about what the Delta variant would hold. And we were seeing, large increases in the cases. And so that's why everybody was talking about it, because it was, how bad is this going to be? And as we're sort of trying to get more information, there's a lot of unknowns. And so I think it's the same with this variant as well, that, the reason we're talking about it so much is because there's so much unknown, and because the information that we're receiving about it is changing almost daily. So I think that's why we're not hearing about it as much. I think that what we saw with the Delta variant is that there was quite an increase in the number of cases, and that there was a little bit of a shift in the age groups that we saw most affected. There was sort of a shift to the younger age groups, and I think part of that was because our older, anybody who was greater than 12 could get vaccinated, and so many people, especially in the senior citizen category, were vaccinated. And so the younger people who weren't vaccinated yet were more likely to have symptomatic cases of COVID. I think the other thing is that many children went back to school around that time. And so I think that the pool testing of asymptomatic kids has actually been fantastic. And I'm really glad that Baltimore City is doing that. But it also means that we pick up cases that, might have not otherwise been picked up. And also that people, are testing their children when in cases where they may not have, tested them before, but because, they have a runny nose and a little bit of a cough in the summer when they were seeing nobody, the family might have not opted not to test them. But now that they're in school, they actually need to be tested. So I think we're seeing perhaps, increased testing for kids. And so we saw increased number of cases. What we did see, though, was that compared to, especially in this Baltimore area, we've actually done quite well. And I've actually been really pleased with how we haven't seen huge increases in the number of hospitalizations and deaths. And I think that's really a tribute to the fantastic job that people have done in getting vaccinated, which I think has really protected themselves against hospitalization and death. So I think that's been great. We're still within sort of the Delta wave. And I think that maybe some people have known that we've kind of plateaued a little bit and even seen a little bit of an increase after Thanksgiving. So I think, it's not over, but I think that fortunately it hasn't been in terms of hospitalizations as bad as what we saw last winter.
Thank you. And I'll end this with the last question here. I'm just kind of wrap up Sheldon's questions. Are the kids wearing masks in school forever? Is there an end in sight? Dr. Elliot, what do you think about that?
That is a great question. I would love for there to be an end in sight, and would love to be able to say like, oh yeah, this time next year, take them off. What we know from this pandemic and from dealing with this is that there's a lot of unknowns, like Dr. Baudry said. And I feel like we've been communicating. And overall, I think that the road there, we are still on. We have some work to do in terms of vaccination, in terms of boosters, in terms of like global vaccine equity, all of those things before I can fully say, oh yeah, like I think the end is in sight. This is what I would say, Dr. Baudry.
Yeah, I mean, I think it's really hard, as we know, to predict the future. And I remember at the very beginning of the pandemic, none of us thought that, almost 2 years later, we'd be still at this and still going through this. So I think it's hard to predict. I am hopeful that, our kids are not going to be masked forever. A lot of it depends on transmission and how serious, getting a case of COVID can be. And so I think, we're well on our way in terms of hopefully, vaccinating, that whole population. Or at least making it, available to them. And hopefully with that, and also, with time, we'll see the cases continue to sort of taper down. So that's the hope. And, I think that we're in a better place than we were last year. In terms of, we have an amazing tool, vaccination, that we didn't have last year, and we have a much better understanding of COVID. But I definitely feel, as a mom to kids who are also masking, I definitely feel that, just a longing for returning back to the way that school was pre-2020. So I feel you. But we're on our way, and I'm hopeful that we'll get there.
Dr. Baudry, Dr. Elliot, thank you all so much for joining us this evening. Sheldon, Courtney, we really appreciate your input this evening. Thank you for helping us drive the conversation with our pediatric experts. So good to have you all back. I want to say to everyone, including Dr. Baudry and Dr. Elliot, join us on Thursday at Tyrone's house, where Tyrone takes the helm of the show and invites us for a more casual conversation in the same very important topics that we are dealing with every day. That's all we have for today. It's so good to be back and again have our guests back. Take great care, everyone, and we'll see you next time.
Thanks so much for having us.
Certainly.
Thank you so much.